Mr. Reed, if you can hear me, blink twice. Olivia Bennett stood beside the ventilator with one hand suspended above the emergency call button. The neurological intensive care unit had gone strangely quiet around her. Through the glass wall, a respiratory therapist waited beside the equipment that would remove Mason Reed's breathing tube. His sister sat in the family room, holding the authorization she had signed less than an hour earlier. Mason lay completely still. No movement in his arms. No movement in his legs. No expression on his face. Then his eyelids closed. Once. A pause. Twice. Olivia stopped breathing. She leaned closer, watching for any sign that the movement had been accidental. Do it again. 2 deliberate blinks. The respiratory therapist entered. Olivia, they're ready. She pressed the emergency button. Stop the extubation. Before we continue, subscribe and tell us in the comments where you're watching from, because the smallest response in this room was about to expose the largest mistake the hospital had made. 11 days earlier, Chief Petty Officer Mason Reed had been pulled from cold Atlantic water after a training vessel collided with a support craft during a nighttime maritime exercise. Witnesses said the impact threw him against a steel railing before he disappeared beneath the surface. He remained underwater for several minutes. When rescue divers found him, he had no purposeful movement and barely any spontaneous breathing. His heart was still beating, but weakly. He was intubated aboard the rescue vessel and flown to Harbor Point Naval Medical Center. The first scans showed damage in the brainstem. Combined with the submersion, the prolonged sedation, and Mason's complete inability to move, the team concluded that he had suffered devastating global neurological injury. He opened his eyes at times, but he did not follow commands. He did not turn toward voices. He did not withdraw from pain in a consistent way. The official description in his chart became wakefulness without meaningful awareness. Dr. Adrian Walsh, director of the Neurological Intensive Care Unit, had examined Mason on 6 different days. Each evaluation produced the same result. No movement of the limbs. No speech. No reliable facial expression. No evidence, in Walsh's opinion, that Mason understood what was happening around him. Rebecca Reed had spent every one of those 11 days beside her younger brother. She played recordings from his SEAL team. She read messages from men who had served under him. She brought the same battered watch Mason had worn since joining the Navy and placed it near his hand. He never reached for it. On the 10th day, Walsh met with Rebecca, the hospital ethics team, and Commander Isaac Cole, Mason's military liaison and longtime friend. Walsh spoke carefully. The breathing machine is keeping his body alive, but we have no convincing evidence that he is consciously experiencing the world around him. Rebecca stared at Mason through the conference room glass. Could he recover? We cannot say impossible. Medicine rarely allows that word. But meaningful recovery appears extremely unlikely. Would he ever speak? Probably not. Walk? No. Know who we are. Walsh hesitated. We have not seen evidence that he does. Isaac looked down at his folded hands. Mason had once told him that he did not want machines preserving a body after the person inside was gone. The conversation had happened after another operator suffered a catastrophic head injury. Rebecca remembered Mason saying the same thing. Do not keep me here if I am not here anymore. She signed the authorization for compassionate withdrawal of the ventilator. The procedure was scheduled for 4 that afternoon. Olivia Bennett learned about it at the beginning of her shift. She had been hired at Harbor Point only 7 weeks earlier. At 27, she was the youngest nurse regularly assigned to the neurological unit and still needed a senior nurse to verify several specialized procedures. Caroline Mercer, a veteran ICU nurse, handed her Mason's chart. You're preparing room 8 for compassionate extubation. Olivia looked toward the glass room at the end of the corridor. The Navy SEAL? The family will come in around 3:30. Respiratory removes the tube at 4. Morphine and medication for secretions are already ordered. Olivia reviewed the chart. Has he ever shown controlled eye movement? Caroline shrugged. He opens them. Sometimes they drift. Sometimes he stares. Does he track? Not reliably. Was vertical movement tested separately? Caroline gave her a tired look. Dr. Walsh has examined him 6 times. That wasn't my question. It's a simple assignment, Olivia. Clean him, reposition him, and make the room presentable for the family. He doesn't know anyone is there. Olivia disliked the sentence immediately. During her final year of nursing school, she had completed a rotation at a neurological rehabilitation center. One of the patients there had been a 34-year-old teacher diagnosed elsewhere as unconscious after a brainstem stroke. He could not move his limbs. He could not speak. He could barely control his face, but he was conscious. His first communication had been made through vertical eye movements. No one had tested for nearly 3 weeks. Olivia entered Mason's room and introduced herself despite what the chart said. "My name is Olivia Bennett. I'm your nurse today. I'm going to adjust your position, clean your face, and explain everything before I touch you." Mason stared toward the ceiling. His face was leaner than the photographs Rebecca had placed around the room. He was 39, but the stubble along his jaw and the exhaustion around his eyes made him look older. A ventilator tube entered his mouth. Adhesive secured it against his face. Olivia checked his pupils, skin temperature, and sedation record. He had received no continuous sedative for nearly 36 hours. Pain medication had been reduced to small scheduled doses. She moved to his right side. "Mason, I'm going to clean around your eyes." His gaze shifted. Not much. Only a slight upward movement followed by a turn in her direction. Olivia stopped. She moved toward the foot of the bed. His eyes did not follow. She returned to the right side. After several seconds, his gaze moved again. "Are you looking at me?" Nothing happened. She raised one hand. "Look up." His eyes drifted upward, but too slowly to call deliberate. Caroline entered with clean bedding. "You're going to make yourself crazy looking for meaning in every movement." I think he followed my voice. "People in this condition have reflexive eye movements." Olivia continued speaking to Mason while they repositioned him. "We're turning you onto your left side now. You may feel pressure along your shoulder." His heart rate rose from 72 to 87. Caroline checked the monitor. Normal response to movement. It could have been. Olivia did not argue. At 3:30, Rebecca entered wearing the same clothes she had worn the previous night. She touched her brother's forehead and tried to speak without crying. "Mace, it's Rebecca. I'm here." Mason's eyes remained open. Rebecca placed the old Navy watch beside him. "Isaac is outside. Your team sent messages. Everyone knows how hard you fought." Her voice broke. "I hope I'm doing what you would want." A tear formed at the corner of Mason's right eye and traveled toward his temple. Rebecca covered her mouth. "Did he just cry?" Caroline inspected the eye. "The surface is irritated. Patients on ventilators often have reduced blinking, so tears collect." Rebecca nodded as though she needed the explanation to be true. She kissed Mason's forehead. "I'm sorry." When she left the room, Mason's heart rate reached 98. Olivia wiped the tear away. "Can you hear her?" His eyes shifted upward. Olivia pulled a chair close to the bed. The extubation medication had not yet been administered. The respiratory therapist was preparing outside. She had only minutes. "Mason, I need you to listen carefully. I'm going to ask you to blink." His eyelids remained open. "If you can hear me, blink twice." One blink. A pause. Then another. Olivia's pulse quickened. She waited 10 seconds. "Do not blink while I count to 3. 1, 2, 3. Mason kept his eyes open. "Now blink twice." 2 blinks. She repeated the sequence with different delays. No blinking during silence. 2 blinks after the command. She changed the instruction. Blink once. 1 blink. Caroline entered again, followed by the respiratory therapist. "What are you doing?" Caroline asked. "He's following commands." Caroline watched Mason. "Blinking is reflexive. Not in the pattern I'm giving him." Dr. Walsh entered as Olivia pressed the emergency call button. "What happened?" "I'm stopping the extubation. He may be conscious." Walsh approached the bed. "On what basis?" "He blinked on command repeatedly." Walsh looked at Mason. "Mr. Reed, blink twice." Mason blinked once. Walsh waited. No second movement came. "He has irregular spontaneous blinking. He's exhausted. Give him time." "The family has made a legally valid decision based on repeated examinations." Olivia stepped between Walsh and the medication pump. "Then another 10 minutes will not harm him." Walsh's expression hardened. "You are not authorized to override the attending physician." I'm reporting a new neurological finding before an irreversible procedure. The respiratory therapist kept both hands away from the ventilator. Walsh looked toward Caroline, but she did not move. Olivia returned to Mason's eye level. We need a second response, Mason. 2 blinks means yes. His eyelids closed twice. Walsh leaned closer. Olivia continued. Look upward for no. Mason's eyes moved toward the ceiling. She tested him with a simple question. Is your name Mason Reed? 2 blinks. Is your name Isaac Cole? His eyes moved upward. No. The respiratory therapist stepped away from the breathing tube. Walsh said nothing. Olivia asked the question that changed the room. Do you understand what they are about to do? Mason stared at her. His face remained completely still. Then he blinked twice. Once for yes. Once to prove there was a man still trapped behind his eyes. Mason Reed had heard every conversation about ending his life. The ventilator continued pushing air into Mason's lungs while every person in room 8 stood motionless. Dr. Adrian Walsh recovered first. No one touches the airway, he said. Not until we repeat the examination under controlled conditions. The respiratory therapist disconnected the extubation equipment and stepped away from the bed. Caroline closed the medication drawer. Olivia remained beside Mason. Keeping her face inside the narrow field his eyes appeared able to reach. Rebecca was called back from the family room. She entered expecting to hear that the withdrawal had begun. Instead, she found Walsh holding a neurological light over her brother's eyes, while Olivia watched every movement. What happened? Olivia turned toward her. Mason responded to commands. Rebecca looked at the motionless body in the bed. What kind of response? He blinked when I asked him to. He also looked upward to answer no. Walsh lowered the light. We have observed a possible pattern. We have not yet established conscious communication. You said he didn't know we were here. I said we had no convincing evidence that he did. Rebecca approached the bed slowly. Mason? His eyes shifted upward. Her hand covered her mouth. Walsh moved to the foot of the bed and addressed everyone in the room. We need to separate purposeful responses from spontaneous blinking, irritation, and expectation. No one will give him hints. No one reacts until the test is complete. He positioned himself where Mason could see him. Mr. Reed. Blink twice. Mason blinked once. Several seconds passed. Then a second blink. Walsh waited. Do not blink. Mason's eyes remained open. Walsh counted silently to 10, watching for a spontaneous movement. Nothing. Blink once. 1 blink. Look upward. Mason's eyes moved toward the ceiling. Look downward. His gaze did not move. Walsh repeated the command. No response. Olivia noticed the strain around Mason's eyes. He may not have downward control. Walsh nodded without looking at her. That is possible. He changed the test. Blink twice if your name is Mason Reed. 2 blinks. Blink twice if your name is Daniel Reed. Mason's eyes moved upward. No. Blink twice if you are in a hospital. 2 blinks. Blink twice if you are aboard a Navy ship. Upward gaze. Walsh continued for nearly 15 minutes. He changed the order of the questions. Sometimes he gave no command at all and watched for random blinking. Sometimes he asked for 2 blinks after making a false statement. Mason responded correctly far more often than chance could explain. The effort weakened him. His blinks became slower. His eyes drifted away from Walsh and did not immediately return. Olivia stepped closer. Close your eyes and keep them closed if you need to rest. Mason's eyelids lowered. They remained shut. Rebecca gripped the bed rail. He understood that. Walsh checked the time. We give him 5 minutes. Olivia wrote the first communication system on a white card and placed it where the staff could see it. 2 blinks. Yes, look up. No one long blink. Repeat eyes closed, rest. She added a warning beneath the instructions. Allow time for a response. When Mason opened his eyes again, Olivia reoriented him before asking another question. Your name is Mason Reed. You are at Harbor Point Naval Medical Center. You were injured during a maritime training accident 11 days ago. Your sister Rebecca is beside you. His eyes moved toward Rebecca. She leaned closer. Mace, if you know who I am, blink twice. Nothing happened. Rebecca's face fell. Olivia placed a hand lightly on her arm. Wait. Mason blinked once. Then again. Rebecca began to cry. "You know me?" 2 blinks. "I thought you were gone." His eyes remained fixed on her. Walsh said, "Ask a question with an answer we cannot infer emotionally." Rebecca tried to steady herself. "When we were kids, did you break my arm?" Mason looked upward. "No." "Did I break yours?" 2 blinks. Rebecca gave a broken laugh through her tears. "You fell out of the tree because I pushed you." Mason blinked twice again. Walsh wrote the response down. Commander Isaac Cole entered during the next round of testing. He stood beside the door until Olivia explained the system. Isaac looked at Mason. "Chief, did we serve together in Bahrain?" 2 blinks. "Did we serve together in Japan?" Upward gaze. "Was your first team 2? Upward gaze. "Team 4? 2 blinks. Isaac stepped closer. "Did you hear me talking to Rebecca yesterday?" Mason blinked twice. The commander lowered his head. He had stood beside the bed and told Rebecca that Mason would never have accepted a life without movement, command, or independence. Mason had heard every word. Walsh stopped the questioning. "Enough. He is tiring." Rebecca turned toward him. "He said he doesn't want the ventilator removed. That decision is suspended." "Suspended?" Walsh looked directly at her. "The extubation order is cancelled pending a full reassessment." Rebecca pressed both hands against the rail. "I signed permission to kill him. You signed permission based on the information we gave you." But he was listening. No one contradicted her. Olivia dimmed the lights and reduced the noise in the room. Mason's heart rate gradually fell. She explained every action before touching him, even when the action was as small as adjusting the sheet. Walsh ordered a new electroencephalogram and requested an emergency neurological consultation. He also asked the ethics team to remain available, but the purpose of the meeting had changed. They were no longer discussing how Mason would die. They were trying to determine how much of him had survived. The EEG technician placed electrodes across Mason's scalp. When Rebecca spoke, the tracing changed. When Walsh gave commands, organized activity appeared over regions associated with attention. The pattern did not prove full awareness by itself. Combined with the repeated responses, it was impossible to dismiss. Olivia wanted to know whether Mason could communicate beyond yes and no. She found a transparent communication board used for patients with severe motor impairment. Letters were arranged in 5 horizontal groups rather than normal alphabetical order. She explained the process carefully. "I'll point to each row. Blink twice when I reach the row containing the letter you want. Then I'll point to each letter in that row. Blink twice again to choose it." Mason stared at the board. "1 long blink if you need me to repeat." His eyelids closed slowly and reopened. Olivia explained it again. This time, Mason blinked twice when she asked if he understood. The first letter took nearly 2 minutes. Olivia moved across the rows. A through E, no response. F through J, no response. K through O. 2 blinks. She pointed to each letter. K, no. L, no. M, no. N, no. O. 2 blinks. She wrote the letter on a pad. O. The second letter was slower. L. Then I. Olivia paused. Rebecca watched from the opposite side of the bed. "He's spelling your name." The next letter was V. Then I. Then A. Olivia looked at Mason. "Olivia?" 2 blinks. Rebecca gave a small smile. "He knows who saved him." Olivia shook her head. "He saved himself. I just stayed long enough to notice." Mason closed his eyes. They allowed him to rest for 10 minutes before continuing. When he reopened them, Olivia asked whether he wanted to spell another word. 2 blinks. The process was exhausting. Each selection required attention, eye control, and patience from everyone in the room. Mason chose the first letter, I, then a space, A, M, another space, H, E, R, E. Olivia read the sentence aloud. "I am here." Rebecca bowed her head until her forehead touched the bed rail. Isaac turned away and wiped his face. Even Caroline, who had called the assignment simple, stood silently beside the door. Walsh looked at the words on the pad for a long time. Then he walked to the charting station and removed the phrase that had defined Mason for more than a week. Wakefulness without meaningful awareness, He replaced it with, "Patient demonstrates reproducible command following through voluntary blinking and vertical eye movement. Conscious awareness strongly suspected." The vascular neurologist arrived shortly before 7 that evening. Dr. Priya Nair entered carrying Mason's original scans and the report from the rescue vessel. She was 41, compact, direct, and known for questioning any diagnosis that did not match the anatomy. She reviewed the communication system before approaching the bed. "Mr. Reed, I am Dr. Priya Nair. I specialize in blood flow and injuries involving the brainstem. I am going to ask questions, but you may close your eyes whenever you need to rest." Mason blinked twice. Priya tested the eye movements herself. Horizontal movement was limited and inconsistent. Vertical gaze remained preserved. Voluntary blinking was present. The pupils responded normally. She reviewed the first MRI beside Walsh. "The injury is concentrated here," she said, pointing to the front of the pons. "The cortex does not look globally destroyed." "He was submerged," Walsh said. "That influenced the interpretation. It was a reasonable concern." "Yes. But a hypoxic injury severe enough to eliminate awareness should produce a different pattern." Priya enlarged the vascular images. The original study had been degraded by movement and swelling. One vertebral artery looked irregular near the base of the skull. The basilar artery appeared narrower than expected. "Was his neck injured during the collision?" Isaac answered. "Witnesses said he struck a steel railing before going overboard." "Hyperextension?" "Possible." Priya looked at Mason's chart. "No one performed dedicated vascular imaging of the neck after the first scan." Walsh's silence answered the question. Priya returned to Mason's bedside. "Mr. Reed, I believe the parts of your brain responsible for thought and awareness may still be functioning. The injury may have interrupted the pathways that allow you to move and speak." Mason watched her. "Do you understand?" 2 blinks. Priya looked at Olivia's communication board, then at the man who had used it to announce his own existence. "He is not unconscious," she said. "He is locked inside." Priya Nair canceled every non-essential test on Mason's schedule and replaced them with a new imaging plan. She ordered thin-section MRI sequences through the brainstem, CT angiography from the chest to the skull, and a dedicated study of both vertebral arteries. She also requested the rescue report, photographs of the damaged vessel, and every note describing the position in which Mason had been found. The original diagnosis had been built around the time he spent underwater. Priya wanted to know what happened before he entered the water. Commander Isaac Cole contacted the training crew. One witness had seen Mason thrown backward by the collision. The base of his helmet struck the railing while his body continued moving, forcing his neck into violent extension. Another sailor remembered Mason reaching toward the back of his neck before falling overboard. "That movement matters," Priya said. Walsh stood beside her in the imaging room. "It could also have been a response to the impact." "It could, but neck trauma followed by a brainstem stroke is not something we can dismiss." Inside room 8, Olivia explained the new tests before the transport team arrived. "Mason, Dr. Nair believes the accident may have damaged an artery in your neck. The next scans will examine the blood vessels supplying your brainstem." 2 blinks. "Do you want me to explain the process again?" Mason looked upward. No. His communication remained slow, but the pattern was becoming clearer. He understood complex information. He remembered who Olivia was. He recognized Rebecca and Isaac. The failure was not in thought. It was in movement. Rebecca followed the transport stretcher to the imaging department, but stopped before the restricted doors. Olivia remained close enough for Mason to see her. During the CT angiogram, contrast traveled through the arteries in his neck and skull. The first images appeared within seconds. Priya traced the right vertebral artery upward. Near the base of the skull, the smooth vessel became irregular and narrow. A thin line separated part of the inner wall from the rest of the artery. "There," she said. Walsh leaned toward the monitor. A dissection. The collision had torn the inner lining of the vertebral artery. Blood had entered the damaged wall, creating a false channel and narrowing the true passage. Farther upward, the artery joined the basilar artery, the central vessel supplying the brainstem. The basilar artery was severely narrowed. A dark, irregular shape clung to one side. "Residual thrombus," Priya said. Part of the clot likely broke away during or immediately after the accident and traveled into the pons, Walsh said. Yes. The new MRI confirmed it. The front portion of Mason's pons had suffered a bilateral infarction. The pathways carrying commands from the brain to the muscles had been destroyed or severely damaged, but the injury stopped before reaching several structures responsible for consciousness. The cortex remained largely preserved. The networks supporting thought, memory, and awareness were still active. Priya placed the scans side by side. This is not global hypoxic destruction. Walsh studied the earlier MRI. The first scan suggested diffuse injury. The edema blurred the boundaries. Movement degraded the vascular images. The submersion history shaped what everyone expected to see. We saw a man who could not move after several minutes underwater, and concluded the cortex was gone. Walsh looked through the glass toward Mason. We were wrong. Priya did not soften the answer. Yes. She returned to room 8 with the images loaded onto a tablet. Rebecca and Isaac stood on one side of the bed. Olivia remained in Mason's line of sight. Priya spoke directly to him first. Mason, the collision tore the inside of an artery in your neck. A clot formed and blocked blood flow to the front of your brainstem. 2 blinks. The injury interrupted the pathways that control most voluntary movement. That is why you cannot move your arms, legs, or face. His eyes remained fixed on her. The parts of your brain responsible for awareness, memory, and understanding were not destroyed. Rebecca closed her eyes. Priya continued. The condition is called locked-in syndrome. You are conscious, but your body cannot show it, except through the eye movements that were preserved. Mason closed his eyes and kept them shut. Olivia checked the communication card. He needs rest. Priya nodded. No one spoke until Mason reopened his eyes. Rebecca stepped closer. Can he feel anything? Priya answered Mason rather than Rebecca. You may still feel touch, pressure, and pain. Some patients feel everything normally. Others have altered sensation. Olivia asked. Can you feel my hand on your arm? She touched his forearm gently. 2 blinks. Does it hurt? He looked upward. No. Rebecca stared at her brother. You felt everything they did? Mason blinked twice. The room became very still. He had felt the suctioning tube in his airway. The needle sticks. The repositioning. The pressure of hands checking for reactions he could not produce. He had heard professionals discuss his body as though he were absent. Walsh approached the bed. Mason, I need to ask you something difficult. Mason watched him. Did you hear the meeting yesterday when we discussed withdrawing the ventilator? 2 blinks. Rebecca turned away. Walsh continued carefully. Did you understand that the breathing tube was going to be removed? 2 blinks. Olivia saw Mason's heart rate rise. She moved closer. You are safe now. The order was canceled. His eyes shifted toward her. Rebecca leaned over the rail. Mace, I believed you were gone. They told me there was no meaningful awareness. I thought keeping the machines on would be against what you wanted. Mason stared at her. I signed it, she said. I signed the order. His eyes closed slowly. Rebecca looked at Olivia. Is that repeat? 1 long blink is repeat. He may be tired. When Mason reopened his eyes, Olivia placed the communication board where he could see it. Do you want to answer, Rebecca? 2 blinks. Spelling took nearly 12 minutes. Mason selected the letters with short periods of rest between them. N-O-T. Then his eyes closed. Rebecca waited. After several minutes, he continued. Y-O-U-R. Olivia read the incomplete message. Not your... Mason tried to continue, but his gaze drifted and the blinks became weak. Stop, Olivia said. You can finish later. Rebecca understood anyway. Not your fault. She placed her hand over his. I should have known. Mason looked upward. No. Priya reviewed the scan again while Olivia allowed him to rest. The diagnosis explained the paralysis, but it did not mean the immediate danger had passed. The tear in the vertebral artery remained open. The clot inside the basilar artery had not disappeared. Blood still moved through a narrow channel around it, but the shape was unstable. A portion could break free and block another branch. The remaining clot could enlarge until the artery closed completely. Priya called Walsh and Isaac into the corridor. The established infarct cannot be reversed, she said. The motor pathways already damaged may recover only partially, if at all. What can still be saved? Isaac asked. The structures that remain perfused. His consciousness. Eye control. Breathing function. Potentially his life. Walsh looked at the angiogram. Anticoagulation. Possibly. But the clot is irregular and the dissection is severe. Medication may not stabilize it quickly enough. Intervention? High risk. We need more detailed vascular mapping before deciding. Rebecca joined them. What happens if the artery closes? Priya answered plainly. He may lose the ability to move his eyes. He may become unable to communicate. The stroke could expand into areas controlling breathing and consciousness. Could he die? Yes. Inside the room, Olivia began organizing everything around Mason's preserved abilities. She placed the communication key where every staff member could see it. She added a sign instructing them to introduce themselves, explain procedures, and wait long enough for a response. Caroline removed the old note warning that Mason did not follow commands. Olivia replaced it with, "Patient is conscious. Communicates through voluntary blinking and upward gaze. Do not assume absence of response." Walsh returned to the bedside. "I owe you an apology," he said. Mason watched him. "We interpreted your paralysis as absence of consciousness. We discussed ending treatment while you could hear us." Mason blinked twice. "I cannot undo that." His gaze stayed fixed. "But I will not hide what happened, and I will not make another decision without including you." After a long pause, Mason blinked twice again. Not forgiveness. Acknowledgement. Priya ordered continuous neurological monitoring and instructed the staff to test Mason's eye responses every 30 minutes. Any change could indicate worsening blood flow. Olivia asked him the same 3 questions each time. "Can you hear me?" 2 blinks. "Can you look up?" His eyes moved toward the ceiling. "Can you close your eyes for 3 seconds?" He obeyed. Shortly after midnight, the second blink came later than the first. At 12:30, his upward gaze weakened. Priya examined him immediately. His pupils still reacted, and he remained conscious, but the change was real. A repeat angiographic image showed that the residual clot had shifted closer to the center of the basilar artery. Olivia returned to Mason's bedside. "Mason, blink twice if you can hear me." 1 blink. A long pause. Then the second. The 2 blinks that had saved his life could disappear at any moment. Priya Nair started intravenous medication to reduce the risk of further clot growth, but she warned the team that it was only a temporary defense. The damaged vertebral artery was still feeding an unstable basilar artery. Mason's second blink had become slower because the blood reaching the surviving parts of his brainstem was no longer consistent. By morning, his eye control improved enough to communicate again. Olivia moved the transparent letterboard into place and adjusted the bed so Mason could see it without straining. The original system required her to point at each row, wait for 2 blinks, and then move through every letter. It worked, but a single sentence could take more than 20 minutes. She reorganized the letters into 5 groups based on frequency and wrote common words on a second board. Yes, no, pain, tired, repeat, family, doctor, stop. She also placed a small digital camera beside the bed, aimed only at Mason's eyes. Walsh noticed it when he entered. "Why is that recording?" "With his permission," Olivia said. "It allows us to review whether a response was deliberate when he becomes too tired to repeat it." Walsh looked toward Mason. "Did you consent to the camera?" 2 blinks. Olivia added, "The recordings will be part of the clinical chart. No personal devices. No staff filming him for curiosity." Walsh nodded. The young resident who had once referred to Mason as an empty body had not returned to the room. Every person entering now introduced themselves and waited for acknowledgement. The difference was small from the hallway. Inside Mason's mind, it changed everything. Olivia asked whether he wanted to describe what he remembered from the previous 11 days. 2 blinks. Rebecca sat near the window. Isaac remained behind her, unsure whether he had the right to hear what Mason had endured. Olivia began with simple choices. "Did you understand speech the entire time?" 2 blinks. "From the first day." Upward gaze. "No." "Did awareness return before the doctors believed it did?" 2 blinks. Using the board, Mason explained that his earliest memories came as fragments, Cold water. A light above him. Pressure in his throat. Voices that disappeared before he understood where they came from. Then the sedation weakened. The room became clear. His body did not. He had tried to move when Rebecca first touched his hand. The command formed normally in his mind. But nothing followed. He tried to turn his head toward Isaac's voice. He tried to pull away during suctioning. No one saw movement because there was none. Olivia asked, "Could you feel the procedures?" 2 blinks. Painfully. 2 blinks again. Rebecca closed her eyes. Mason used the board to explain that the ventilator suction had been the worst. He heard staff warn one another that it might cause discomfort, then proceed without speaking to him because they believed he could not understand. He felt the catheter in his airway. He felt pressure in his chest. He felt panic when he could not cough, turn away, or ask them to stop. Olivia wrote each statement into the chart. Walsh read over her shoulder. These accounts should be documented as patient-reported experience. They are. Mason's eyes moved toward the board again. Olivia resumed. He described listening to professionals speak over him. One physician told a student that neurological reflexes could continue after the person had effectively disappeared. A nurse complained that turning him every 2 hours was exhausting when there was no chance of recovery. Another staff member adjusted his sheet and said, "At least he doesn't know how bad this is." Mason knew. He heard Rebecca read messages from his team. He heard Isaac repeat the promise Mason had made years earlier about not wanting machines to preserve an empty body. He heard Walsh explain that continuing the ventilator might only prolong a biological process without preserving a person. Rebecca stood abruptly. "I need a minute." Mason looked toward her. She stopped at the door. Olivia asked, "Do you want Rebecca to stay?" 2 blinks. Rebecca returned to the chair. "I'll stay." The next message took nearly 15 minutes to form. Olivia read it only after Mason confirmed every word. "I tried to tell them." Walsh stepped closer. "How?" Mason selected another phrase. Blinking. He had attempted to answer during examinations before Olivia arrived. Someone would ask him to move a hand or squeeze fingers. When nothing happened, the examiner looked away to write notes. Mason blinked. No one was watching. He tried again, when a nurse mentioned removing the breathing tube. She was focused on the medication pump. He tried to hold his eyes open when Rebecca asked whether he wanted her to let him go. Rebecca had been crying with her head against the bed. No one watched long enough to see a pattern. "I noticed because of my rehabilitation rotation," Olivia said. Mason looked upward. "No." She waited. He began spelling. "You looked." Olivia swallowed. The distinction mattered to him. She had not possessed a rare power. She had simply looked at his eyes longer than everyone else. Rebecca moved beside the bed. "Mace, I need to ask you something." His gaze shifted toward her. "Are you angry with me?" He looked upward immediately. "No." Rebecca shook her head. "You don't have to protect me." Again, upward gaze. "No," Olivia interpreted. Rebecca pressed her hand against the bed rail. "I signed the order after hearing you say for years that you never wanted to live completely dependent on machines." Mason blinked twice. "You remember saying that?" 2 blinks. "But you want to live now?" 2 blinks, stronger than the previous response. Rebecca's voice broke. "Even if you never walk?" 2 blinks. "Even if you never speak normally?" 2 blinks. "Even if this is permanent?" Mason's eyes closed. Olivia waited, uncertain whether he had chosen rest or could no longer continue. 10 seconds later, he opened them and blinked twice. Yes, the answer was not based on the future Rebecca feared for him. It belonged to the man experiencing the present. Olivia placed the letterboard back in position. Mason began another message. His concentration weakened halfway through, but he refused the option to stop. The complete sentence appeared slowly on Olivia's pad. "Not your fault. They said I was gone." Rebecca bent over his hand. "I believed them." Mason blinked twice. "I should have questioned them." Upward gaze. "No. You forgive me?" A pause. 2 blinks. Rebecca rested her forehead against his fingers, even though they could not close around hers. Walsh waited until Mason had rested before moving into his field of vision. "Mason, I also need to speak to you." His eyes found the doctor. "I examined you repeatedly. I saw the location of the injury, but I gave more importance to the absence of limb movement and the history of submersion." Mason remained still. "I allowed the expected diagnosis to control what I saw. When your responses did not fit it, I classified them as reflexes." Walsh lowered the side rail so nothing blocked Mason's view. "I recommended withdrawal of treatment. I am sorry." Olivia offered the board. Mason agreed to respond. The message required less time than the others. "Listen longer." Walsh read it twice. "I will." Mason looked upward. "No." Walsh understood. The statement was not only for him. "I'll make sure everyone does." 2 blinks. By afternoon, Olivia had learned the rhythm of Mason's exhaustion. After several words, his gaze became less precise. His eyelids lowered unevenly. The space between responses increased. She stopped before he reached complete failure. Communication was not a test he had to pass. It was physical work. Caroline entered to assist with repositioning. She introduced herself, explained every step, and waited for Mason's approval before touching him. Afterward, she remained near the bed. "I was the nurse who told Olivia you didn't know anyone was here." Mason watched her. "I said it because I believed the chart, and because believing it made the work easier." She took a breath. "I'm sorry." Mason selected a response from the common word board. "Listen." Caroline nodded. "I will." Isaac spoke with Mason near sunset. He asked whether Mason wanted the SEAL team informed that he was conscious. 2 blinks. "Do you want them to visit?" 2 blinks. "Do you want me to tell them about the withdrawal order?" Mason looked upward. "No." Isaac studied him. "You're protecting Rebecca." Another upward gaze. "No." Mason spelled a short explanation. "My story. Later." Isaac accepted the boundary. "Your decision." 2 blinks. Priya entered during the evening examination and reviewed the vascular plan. The anticoagulation had slowed clot formation, but it could not repair the torn artery. "We are discussing an endovascular procedure," she told Mason. "It may be the best chance to prevent complete basilar artery blockage." His eyes remained attentive. "The procedure itself could cause a stroke or fatal bleeding. I will explain every option directly to you before asking for a decision." 2 blinks. Olivia began the scheduled neurological check. "Can you hear me?" 2 blinks. "Look upward." His gaze moved. "Blink once." 1 blink. She waited 30 minutes and repeated the examination. This time, Mason stared ahead. "Mason, can you hear me?" No movement. Olivia moved directly into his field of vision. "Blink twice." His eyes remained open. No blink. "Look upward." Nothing. The monitor showed that his heart was still beating normally. His pupils remained reactive, but the only movements connecting him to the room had disappeared. Olivia called for Priya. The neurologist arrived within minutes and ordered emergency vascular imaging. As the transport team moved Mason toward the scanner, Olivia stayed beside his head. "You are at Harbor Point." "I am Olivia. We know you are still here." He gave no sign that he heard her. The new angiogram appeared on the monitor before the scan had fully completed. The clot inside Mason's basilar artery had grown. Priya Nair compared the new angiogram with the study performed only hours earlier. The difference was unmistakable. The clot attached to Mason's basilar artery had extended farther into the remaining channel. Blood still reached the brainstem, but the passage had narrowed to a thin, irregular stream. "He is not fully occluded yet," Priya said. "But we are losing time." Adrian Walsh watched the live images. Could the anticoagulation break it apart? It could prevent additional growth. It will not repair the dissection, and it may not dissolve this clot before the artery closes. Thrombectomy? The clot is attached to the damaged wall. Pulling it without stabilizing the artery could tear the vessel or release fragments into smaller branches. Priya enlarged the torn section of the right vertebral artery. "My plan would be to enter through the femoral artery, reach the vertebral circulation, remove the unstable portion of the clot, and place a small stent across the dissection. That may restore a reliable channel into the basilar artery." Walsh looked toward Mason inside the scanner. "What are the chances?" "Without intervention, I believe he may lose the remaining eye movements, consciousness or respiratory function within hours or days. And with it? Stroke, hemorrhage, rupture of the vertebral artery, complete basilar occlusion during the procedure, coma, death. Neither option offered safety. Only one offered Mason a chance to choose his future. He returned to room 8 with his eyes open but unresponsive. Olivia stood directly in front of him and repeated the orientation slowly. You are Mason Reed. You are at Harbor Point Naval Medical Center. The clot in the artery supplying your brainstem has grown. Dr. Nair is preparing a treatment. No blink followed. Rebecca gripped the rail. Can he still hear us? We don't know, Walsh said. Olivia continued speaking. We are not going to assume silence means absence. We will keep explaining. Priya requested an emergency meeting with vascular neurology, interventional radiology, ethics, critical care, and Mason's legal representative. Rebecca and Commander Isaac Cole attended. Olivia remained beside Mason, repeating every important point in language he could understand. The discussion began in the conference room, but Olivia insisted that the final explanation occur at his bedside. One physician questioned whether the risks of intervention were justified. The established pontine injury is extensive, he said. Even if the procedure succeeds, he may remain ventilator-dependent and completely paralyzed. Rebecca's face tightened. Another member of the ethics team asked, Are we preserving meaningful recovery or extending a condition he may later find intolerable? Olivia looked through the glass wall at Mason. He already answered that. The room turned toward her. He told his sister he wants to live even if he never walks or speaks normally. That was before this deterioration. The physician replied. His current capacity to understand may be uncertain. Then we test his capacity. We do not replace his decision with our opinion about the value of his life. Walsh remained silent for a moment. Then he said, She is right. The same doctor who had recommended withdrawal now addressed the room. Mason has demonstrated consistent understanding, memory, and voluntary communication. Severe physical disability does not remove decision-making capacity. Rebecca looked at the consent form on the table. He nearly died because everyone thought he couldn't answer. We are not doing that again. The meeting moved into room 8. Priya positioned herself where Mason could see her. Mason, the artery supplying your brainstem is becoming more blocked. Medication has not stopped the clot from growing. His eyes remained still. I can attempt to treat it from inside the blood vessel. I would pass a catheter from your groin into the injured vertebral artery. I may remove part of the clot and place a stent across the tear. Olivia watched his eyelids closely. Priya continued. The procedure could cause another stroke. The artery could rupture. You could lose consciousness, enter a coma, or die. Mason gave no response. Without the procedure, I believe the artery may close completely. You could lose your ability to communicate. The stroke could spread into areas controlling breathing and consciousness. His right eyelid moved slightly. Olivia leaned closer. Mason, blink once if you need us to repeat. A single, weak blink. Priya explained everything again, using shorter sentences. Afterward, Olivia tested him with questions that did not reveal the expected answer. Is Dr. Nair offering medication only? Mason looked upward. No. Is she offering a procedure inside the artery? 2 slow blinks. Could the procedure kill you? 2 blinks. Could refusing it also lead to death? 2 blinks. Rebecca covered her mouth. Olivia continued. Do you understand that surviving may not restore movement to your arms or legs? 2 blinks. Do you want more time before deciding? Mason looked upward. No. Do you want the procedure? His eyes closed once. Opened. Closed again. 2 deliberate blinks. Priya nodded. I need more than yes or no for the record. I need him to express his choice in his own words. Olivia placed the transparent letterboard above Mason's chest. His eye control was weaker than before. Each selection required several attempts. She moved through the rows slowly and stopped whenever his gaze lost focus. The first letter was I, then a space. W-A-N-T. His eyes closed for nearly a minute. Rebecca whispered, He can stop. Olivia shook her head. He will tell us if he wants to stop. Mason reopened his eyes. T-O. Another space. L-I-V-E. Olivia wrote the completed sentence in large letters. I want to live. Priya repeated it aloud. Mason Reed has chosen endovascular treatment. 2 blinks. The consent process was recorded using hospital equipment. Walsh, Rebecca, Isaac, Priya, and an ethics representative witnessed Mason answer the same essential questions in different forms. He understood the procedure. He understood the risks. He understood the likely consequences of refusing. His answer did not change. Rebecca signed only as a witness. For the first time since the accident, no one asked her to decide whether her brother's life was worth continuing. Isaac approached the bed after the procedural team left to prepare the angiography suite. He carried a small black case. Inside was Mason's silver seal trident. Isaac placed it on the bedside table within Mason's view. Your team knows you're conscious, he said. They know you're going into surgery. Mason blinked twice. They asked what they should do. Olivia brought the letterboard closer. Mason selected only 3 words. Wait for me. Isaac swallowed. We will. Mason looked upward. No. He spelled again, correcting the message. Don't wait. Start. Isaac understood. Mason did not want his team frozen beside his hospital bed, or treating him as a mission that had never ended. He wanted them to continue training, serving, and living. Isaac placed 2 fingers against the trident. Yes, Chief. The transport team arrived. Olivia secured the communication board to the stretcher and placed the instruction card above Mason's shoulder. 2 blinks. Yes. Look up. No. Wait for his response. Priya met them outside the angiography room. Mason, I will keep you under light sedation as long as it remains safe. Olivia will stay near your head so we can monitor communication. 2 blinks. Rebecca leaned down and kissed his forehead. I'll be here when you come back. He blinked twice. As the doors opened, Walsh looked at the man whose silence he had once mistaken for absence. Proceed when ready, he told Priya. Mason's eyes moved toward Olivia. She raised the letterboard one final time. He did not need it. 2 blinks gave the order. For the first time since the accident, every person in the room followed Mason Reed's command. The angiography room was colder than Mason expected. He could not shiver. He could not turn his head away from the lights or ask anyone to raise the temperature. His body remained flat beneath the imaging equipment, while the ventilator delivered each breath with mechanical precision. Olivia stood near his right shoulder, outside the sterile field. She had placed the communication card where he could see it. 2 blinks. Yes. Look up. No. 1 long blink. Repeat. Priya Nair checked the arterial images one final time. The right vertebral artery was torn near the base of the skull. Beyond it, an irregular clot projected into the basilar artery, leaving only a narrow channel for blood to reach the surviving structures of Mason's brainstem. We will begin through the right femoral artery, Priya said. You may feel pressure near your groin, but you should not feel the catheter moving inside the vessel. 2 blinks. The sedation will remain light while it is safe. Olivia will continue checking your responses. 2 blinks again. The anesthesiologist adjusted the medication. Mason's eyelids became heavier, but his gaze stayed on Olivia. She leaned into his field of vision. Can you hear me? 2 blinks. Are you in pain? His eyes moved upward. No. Do you understand that Dr. Nair is beginning? 2 blinks. Priya inserted the arterial sheath and guided a catheter upward through the aorta. On the monitor, contrast outlined the vessels leading toward Mason's neck. The left vertebral artery was small and contributed little blood. The injured right side carried nearly the entire burden. Priya advanced carefully. The dissection begins here, she said. A thin flap of damaged tissue divided the vessel into a true passage and a false channel. Blood had entered the artery wall, narrowing the route that remained open. Farther ahead, the clot moved slightly with every heartbeat. Walsh watched from the control room. It looks less stable than on the previous scan. It is, Priya replied. She passed a microcatheter toward the narrowing. Olivia continued the neurological checks. Can you hear me? 2 blinks. Look upward. Mason's eyes moved toward the ceiling. Close your eyes for 3 seconds. He obeyed. Priya advanced another millimeter. The guide wire touched the edge of the clot. It shifted. "Stop," she said. Every hand in the room became still. A new injection of contrast showed less blood reaching the basilar artery. Part of the clot had rotated into the remaining channel. "Flow is dropping," the technician said. Mason's heart rate increased. Olivia moved closer. "Mason, can you hear me?" 2 blinks, slower than before. "Look upward." His eyes rose only halfway. Priya withdrew the wire slightly. The clot did not return to its previous position. "We need to aspirate before it fully occludes." She guided a larger catheter toward the unstable material. The path was narrow, and the vessel wall was already damaged. Walsh spoke through the intercom. "If the artery tears, we may lose the entire posterior circulation." Priya continued. The aspiration catheter reached the lower edge of the clot. Beginning suction, blood entered the tubing. The clot stretched but did not release. Priya increased the aspiration carefully. Mason's eyes remained fixed on Olivia. "Can you still see me?" she asked. 2 blinks. "Are you frightened?" 2 blinks. She did not tell him not to be. "I'm staying where you can see me." Another pull. A small fragment entered the catheter, but the larger section remained attached to the artery wall. The technician watched the flow reading. "Basilar perfusion is decreasing." Priya changed the catheter angle. Again, the clot shifted farther. The narrow channel disappeared from the monitor. "No flow," the technician said. An alarm sounded. Mason's blood pressure rose sharply, then began falling. Olivia looked directly into his eyes. "Mason, look up." Nothing happened. "Blink twice." His eyelids remained open. "Mason?" No movement. The only voluntary channel he possessed had vanished. Walsh entered the room. Possible extension of the Pontine stroke. Priya did not look away from the monitor, or temporary loss of blood flow. "I need the clot out now." She advanced the aspiration catheter until its opening pressed directly against the obstruction. Maximum controlled suction. The tubing darkened. For several seconds, nothing changed. Then a long piece of clot entered the catheter. Contrast was injected immediately. A thin stream of blood reappeared inside the basilar artery. "Partial flow restored," the technician said. Olivia remained focused on Mason. "Look up." No response. "Blink once." Nothing. Walsh checked his pupils. "Still reactive." "That doesn't prove awareness," the anesthesiologist said. "It doesn't disprove it either," Olivia replied. She lowered her voice. "Mason, I know you may not be able to make the movement. I am not going to assume you are gone." His face remained still. Priya examined the angiogram. The largest clot fragment had been removed, but the torn artery continued narrowing the channel. Smaller material remained attached near the dissection. "If we stop now, it can close again," she said. Walsh looked at Mason. "Can we continue without monitoring his responses?" "We may have no choice." Olivia noticed a tiny movement near his right eye. Not a full blink. A brief contraction in the lower eyelid. "Mason, do that again." Nothing. She waited. "Move your right eyelid if you can hear me." The muscle tightened once. Walsh moved closer. Could be fasciculation. Then it should not follow a command. Olivia changed the instruction. "Do not move." She counted silently. No contraction. "Move it now." The lower eyelid tightened. Priya looked toward them. "He is still following." Olivia created a temporary system. 1 eyelid movement means yes. No movement after 2 attempts means we repeat the question. She asked, "Can you hear me?" 1 contraction. "Do you understand that blood flow stopped briefly?" 1 contraction. "Do you want Dr. Nair to continue?" The eyelid moved again. The response was weak, but it was deliberate. Priya returned to the vascular map. "To secure this artery, I need to place a stent across the dissection. It will press the torn wall back into place and create a stable channel." Walsh studied the branches leading from the basilar artery. "One of those perforators originates close to the landing zone." "I know. If the stent covers it, he could lose additional brainstem tissue." Olivia explained the risk directly to Mason. "The artery is open again, but it may close unless Dr. Nair places the stent. The stent could block a smaller vessel and cause another stroke." His lower eyelid contracted. "Do you understand?" Another contraction. "Do Do you want her to continue? The muscle moved once more. Priya prepared the device. Before advancing it, she performed another angiographic run. The restored flow remained weak. The vessel narrowed and expanded with every pulse. A second clot fragment still clung to the damaged wall. We need to move now. The stent entered the catheter. Olivia continued speaking even when Mason could not answer every question. Your name is Mason Reed. You are at Harbor Point. Dr. Nair removed part of the clot. She is now repairing the torn artery. His right eyelid tightened faintly. Priya advanced the stent toward the dissection. The device had to cross the unstable segment without disturbing the remaining clot. Its distal end needed to stop before the small branches supplying the surviving areas of Mason's brainstem. 1 millimeter too far could destroy what remained. 1 millimeter too short could leave the artery unstable. The monitor showed the stent approaching the damaged vessel. Mason's eyelids stopped moving. Olivia repeated the command. No response. His pupils remained reactive, but the fragile signal had faded again. Priya held the device at the edge of the torn artery. The procedure is not finished. Olivia kept her face directly above Mason's. She knew he might still hear every word, even if his body had lost the ability to answer. The procedure was not finished, but Mason's only voice was already fading. Priya Nair held the undeployed stent at the edge of Mason's damaged vertebral artery. The monitor showed the remaining channel as a narrow line of contrast. Beyond it, the basilar artery filled slowly and unevenly. The clot fragment still attached to the torn wall moved with every pulse. Mason's right eyelid no longer contracted. Olivia remained close to his face. Mason, your name is Mason Reed. You are at Harbor Point. Dr. Nair has restored some blood flow, but the artery is still unstable. No response. Priya enlarged the vascular map. The stent needed to cross the entire dissection and anchor inside healthy vessel on both sides. Its far end would rest near several perforating arteries that supplied the surviving areas of Mason's brainstem. Walsh studied the same image. That branch is less than 2 millimeters from the landing zone. I see it, Priya said. If the stent covers the opening, we may cause another infarct. And if you stop short, the dissection remains exposed. The artery can collapse or form another clot. The technician called out Mason's pressure. 86/54 and falling. His heart rate slowed into the 50s. The anesthesiologist reduced sedation and administered medication to support his blood pressure. This may be brainstem ischemia, Walsh said. Priya checked the latest angiographic run. Flow through the basilar artery had weakened again. The vessel is narrowing around the catheter. We cannot wait. Olivia moved even closer. Mason, I need you to listen. They are ready to place the stent. It could save the remaining blood flow. It could also damage another part of your brainstem. His eyes remained open and still. She did not know whether the signal had been lost because the movement pathway had failed, because the blood flow had fallen, or because Mason's awareness was fading. She continued anyway. You already chose this procedure. You told us you wanted to live. No movement. Priya positioned the stent across the dissection. Distal marker approaching the perforator. The technician adjusted the view. 1 millimeter forward. Priya advanced. Stop. The stent now covered the torn section, but its distal edge sat dangerously close to the small branch. Walsh looked toward Mason. We have no reliable neurological response. Olivia answered without turning away. He may still understand. He may. Then speak as though he does. Walsh stepped into Mason's field of vision. Mason, Dr. Nair is in position. Your blood pressure is unstable and the artery is narrowing again. We need to deploy the stent now. Nothing changed. Olivia thought of the 11 days Mason had spent hearing questions directed at a body no one believed contained a person. She would not repeat that mistake because his last visible movement had disappeared. Mason, she said. Blink twice one more time. No response. The blood pressure monitor alarmed. Priya's hand remained on the deployment control. Olivia, I need an answer or we proceed under his documented consent. Olivia nodded, but she kept speaking. Not for the doctors. Not for the machines. Tell me you're still here. Mason's eyelids did not move. 5 seconds passed. Then his right eyelid closed. Once. It reopened slowly. The room remained silent. Olivia waited. A second blink came several seconds later. Weak, incomplete, deliberate. "He's here," she said. Priya deployed the stent. The device expanded inside the vertebral artery, pressing the torn inner wall back into place. On the monitor, the metal mesh opened from one end to the other. Contrast entered the vessel. For one terrifying second, the small perforating branch disappeared. Walsh leaned toward the screen. "I don't see it." Priya changed the imaging angle and injected again. A thin branch appeared behind the stent, still open. The basilar artery began filling more rapidly. The unstable clot fragment flattened against the repaired vessel wall. Blood passed through the center of the stent instead of entering the false channel created by the dissection. "Flow improving," the technician said. Mason's pressure rose, 92/60, then 100/68. His heart rate returned to the 70s. Priya waited before moving any catheter. Repeat angiogram. Contrast traveled through the right vertebral artery. The dissection no longer narrowed the vessel with every heartbeat. The basilar artery filled continuously. The remaining clot stayed fixed against the wall. "No distal emboli," Priya said. "No new occlusion," the technician confirmed. Olivia watched Mason's eyes. "Can you hear me?" Nothing. She counted slowly. His gaze moved upward, only a few millimeters. But it moved. "Look at me." His eyes lowered again. Blink twice. One blink, then another. The communication channel had returned. Olivia exhaled for the first time in what felt like minutes. Priya performed one final angiographic run, confirming flow through the basilar artery and the small branches supplying the pons. "The stent is stable. The dissection is covered. The procedure is complete." Mason blinked twice. The anesthesiologist increased sedation for removal of the catheters and transport. Before his eyes closed, Olivia gave him the last update. "The artery is open. The stent is in place. You made it through." His eyelids lowered. This time, everyone understood that closed eyes did not mean absence. Mason was transferred to the neurological intensive care unit under strict blood pressure control. Priya ordered immediate CT imaging to look for hemorrhage and a new MRI to determine whether the period of reduced flow had expanded the stroke. Rebecca and Isaac waited outside the unit. Olivia met them near the doors. "The stent is open," she said. "Blood flow has been restored." Rebecca searched her face. "Is he conscious?" "He followed commands before sedation." "Did he have another stroke?" "We don't know yet." The first CT showed no intracranial hemorrhage. The later MRI revealed several tiny new areas of injury near the original pontine infarct, but no catastrophic expansion. The structures responsible for awareness remained intact. Priya explained the results to Rebecca and Isaac. The procedure did not reverse the established damage. Mason still has locked-in syndrome, but the artery is stable, and the immediate threat of complete basilar occlusion has been removed. "Will his eyes keep working?" Rebecca asked. "They are working now. And the rest of him?" Priya did not offer false hope. "We cannot predict that yet." When sedation was reduced, Mason opened his eyes. Olivia stood beside him with the communication card. "Your name is Mason Reed. You are at Harbor Point. Dr. Nair repaired the damaged artery and restored blood flow." 2 blinks. "Do you remember the procedure?" 2 blinks. "Do you remember the stent being placed?" Upward gaze. "No." "Do you remember me asking you to blink twice?" A pause. 2 blinks. Rebecca entered after the neurological examination. She moved into his field of vision and waited. "Mace, they fixed the artery." 2 blinks. "You scared us." Upward gaze. "No." Rebecca almost laughed. "You didn't scare us?" Another upward gaze. "No." Olivia brought the letterboard closer. Mason selected 3 words. "I was busy." Rebecca laughed and cried at the same time. Walsh waited until Mason had rested before speaking with him. "The procedure succeeded. There was no major hemorrhage and the additional injury appears limited." 2 blinks. "I also informed hospital leadership that your treatment before Olivia identified your responses requires formal review." Mason watched him. "I documented that we nearly withdrew life support from a conscious patient because we failed to test preserved eye movement properly." 2 blinks. "I will present the case myself." Mason selected a message through the board. "No excuses. Walsh nodded. None. The hospital review began within 48 hours. Walsh presented the timeline from Mason's admission to the canceled extubation. He included the repeated examinations, the initial interpretation of the MRI, the missed vertebral artery dissection, and Olivia's documented command-following tests. He did not describe the event as an unavoidable mystery. He described each assumption that had allowed it to happen. The neurological unit adopted immediate changes. Every patient with suspected severe brain injury received standardized tests of vertical gaze and voluntary blinking. Brainstem injuries required dedicated vascular imaging when trauma to the head or neck was possible. Examinations obscured by sedation, swelling, or movement had to be repeated before irreversible decisions. Staff could no longer conclude that a patient lacked awareness based only on the absence of movement in the arms, legs, or face. Communication methods had to be attempted before describing a conscious patient as unable to participate in care. Olivia helped write the first bedside protocol. She insisted on one instruction appearing at the top: explain before touching. Wait before deciding there is no response. Caroline asked Olivia to teach the unit how to use transparent letterboards and eye-based communication. No one called her the inexperienced nurse anymore. But Olivia refused to let the story become one about a gifted rookie defeating careless doctors. She told every group the same thing. I did not diagnose him by instinct. I gave a clear command, watched long enough, and repeated the test. Anyone in that room could have done it. Mason remained in intensive care while the stent was monitored. His blinking became reliable again. Vertical gaze remained intact. He could not move his arms or legs, and the ventilator continued breathing for him. The immediate crisis had ended. The future had not become easy. Mason had survived the operation, but no one knew how much of his body he would ever regain. Recovery began with goals so small that most people outside the neurological unit would not have recognized them as progress. Mason learned to breathe without full ventilator support for 5 minutes. Then 12. Then 20. A tracheostomy replaced the tube through his mouth, making airway care safer and reducing the constant pressure in his throat. During the day, the machine began doing less of the work. At night, it still carried most of the burden. His arms and legs remained motionless. His eyes became his voice. Olivia introduced a computer controlled by infrared tracking. At first, Mason could not hold his gaze on a letter long enough to select it. His eyes tired after only a few minutes, and the machine frequently interpreted involuntary movements as commands. The technician suggested returning to the simple communication board. Mason looked upward. No. Olivia placed the screen in front of him again. We can stop whenever you decide. But we are not stopping because the machine is impatient. 2 blinks. The first complete sentence took 43 minutes. The cursor is too fast. The technician adjusted it. The next sentence took 20. Better. A week later, Mason could form short messages without another person pointing to every letter. For the first time since the accident, he could begin a sentence whenever he chose, instead of waiting for someone to ask the right question. Rebecca sat beside him the afternoon the device's artificial voice was activated. The computer produced a flat, mechanical tone. Rebecca. She froze. It was not Mason's real voice. It was the first voice his thoughts had possessed in weeks. I'm here, she said. His eyes moved across the screen. You were always here. Rebecca lowered her head. I almost wasn't. The cursor moved again. Not your fault. She had already seen those words on Olivia's handwritten pad. But hearing them spoken broke something open inside her. Rebecca pressed her hand against his. I still need you to say it more than once. The machine answered. I can do that. Olivia stood near the doorway, watching the brother and sister speak, without requiring her to interpret every blink. Mason selected another sentence. Olivia was right. Olivia looked at the screen. About what? The mechanical voice replied. I was here. Mason's rehabilitation continued for months. The damage to the front of his pons remained extensive. No treatment could restore the tissue already lost. Priya never promised that he would walk or regain normal speech. She focused on what the restored blood flow had preserved. Consciousness, eye control, memory, the ability to breathe, the possibility of recovering small amounts of movement through surviving pathways. 3 months after the procedure, Mason moved the index finger of his left hand. The motion was so slight that the therapist initially believed it was a muscle spasm. Olivia placed her finger beneath his. Do it again. Nothing happened. They waited. His finger lowered by less than a centimeter. The therapist recorded the movement. Rebecca cried as though Mason had stood from the bed. The recovery did not suddenly accelerate after that. For weeks, the finger remained the only part of his hand he could control. Later, a second finger joined it. He recovered limited movement in his neck and could turn his head a few degrees toward a voice. His legs did not move. His right arm remained completely paralyzed. He continued to require assistance for every physical need, but he was no longer treated as a silent object inside a room. Every decision began with him. When doctors discussed reducing nighttime ventilation, they asked Mason whether the breathing exercises left him exhausted. When therapists changed his schedule, he approved it. When the Navy requested permission to share his case during medical training, he refused until every identifying detail was protected. Commander Isaac Cole visited each week. The first time Isaac entered after Mason received the eye-controlled computer, he stood at attention beside the bed. Mason selected a message. "Sit down. You look ridiculous." Isaac laughed. There he is. The SEAL team sent recordings, photographs, and updates from training. Mason no longer asked them to wait for him. He instructed them, criticized their mistakes, and reminded them that treating him as fragile would not make his injuries smaller. One afternoon, Isaac asked whether Mason still considered himself part of the team. The computer answered immediately. "I am still me." Isaac placed the silver trident beside the screen. "Yes, Chief." Rebecca transformed her guilt into work. She began attending family meetings for patients with severe neurological injuries. She never told families that every motionless patient was conscious or that hope guaranteed recovery. She told them something more honest. Make sure the doctors test every communication pathway before making an irreversible decision. Ask what part of the brain is damaged. Ask what remains. Ask whether sedation, swelling, or equipment could be hiding a response. She also warned them that wanting a patient to be conscious did not make it true. But believing consciousness was impossible could be just as dangerous. Walsh presented Mason's case before the hospital board, the Navy Medical Command, and a national conference on disorders of consciousness. He included his own recommendation for withdrawal. He displayed the original documentation describing Mason as awake without meaningful awareness. Then he showed the video of Mason following Olivia's commands. Blink twice. Look upward. Do not blink. Blink once. Walsh did not describe the event as a miracle. A miracle would allow us to avoid responsibility, he said. This was a diagnostic failure. The patient had preserved vertical eye movement. We failed to test it consistently because his condition did not match the diagnosis we had already accepted. Harbor Point introduced a mandatory assessment for patients with suspected severe disorders of consciousness. It required repeated testing at different times of day, after sedating medication had cleared, using verbal commands involving the eyes, eyelids, mouth, and any muscle group that might remain intact. Brainstem injuries caused by trauma required dedicated imaging of the neck and posterior circulation. Family observations had to be documented instead of dismissed automatically as hope or grief. No withdrawal of life-sustaining treatment could proceed while a new, reproducible response remained unexplained. The protocol did not prevent death. It prevented silence from being mistaken for consent. Priya monitored Mason's stent through repeated imaging. The repaired vertebral artery remained open. No new clot formed. The basilar artery continued supplying the portions of his brainstem that had survived. The vessel is stable, she told him at the 1-year examination. The computer spoke. Better than the first team meeting. Walsh stood beside the monitor. You remember that? I remember all of it. Walsh accepted the answer. I know. Olivia completed advanced training in neurological nursing and communication for patients with profound motor impairment. Harbor Point asked her to lead the development of a bedside system called the 2-blink verification protocol. She disliked the attention placed on her. The protocol depended on ordinary actions. Explain clearly. Give one command at a time. Wait long enough. Repeat the test. Change the command to rule out reflex. Document the response. Assume nothing from the absence of limb movement. Mason reviewed the training materials through his computer. He rejected the first draft. The final line told nurses to look carefully for signs of awareness. Mason replaced it. Do not look for what you expect. Look for what the patient can still do. A year after the accident, Mason returned to the neurological intensive care unit in a motorized wheelchair controlled by his eyes. He breathed independently during the day and used ventilatory support only at night. His left index and middle fingers could move enough to activate a small switch. He controlled his chair, computer, and room devices through a combination of eye tracking and that limited hand movement. His body had not returned to what it had been. His life had not ended where everyone once expected it to. Olivia walked beside him into room 12, where a new patient lay motionless after a brainstem hemorrhage. The woman's chart described her as unresponsive. Her family had seen her eyes move twice, but could not reproduce it for the medical team. Walsh stood beside the bed with Priya and a group of residents. No one discussed withdrawal. No one spoke over the patient as though she were absent. Olivia moved into the woman's field of vision. My name is Olivia Bennett. You are at Harbor Point Naval Medical Center. You had bleeding near your brainstem. We are going to test whether you can understand me. The patient's eyes remained still. Olivia waited. Mason is beside me. He communicates with his eyes because an injury stopped most of his body from moving. Mason positioned his chair where the woman could see him. His screen displayed a message. Take your time. Olivia leaned closer. If you can hear me, blink twice. Nothing happened. A resident shifted his weight. Olivia raised one hand without looking away from the patient. Wait. Several seconds passed. The woman blinked once. Her eyes opened. Then she blinked again. A nurse near the monitor inhaled sharply. Walsh did not call it a reflex. He stepped forward and changed the instruction. Do not blink. The woman kept her eyes open. Look upward. Her gaze rose. Mason moved the cursor across his communication screen. The artificial voice filled the room. Now listen. They had almost ended Mason Reed's life because his body could not answer. The life they saved began with 2 blinks.